Hello, I'm Dr. George Wilson. For the past 10 years, I have directed the women's program at Princeton House Outpatient Services, and I previously served as chairman of psychiatry at Princeton Health. Throughout my career, I have participated in programs for men and women suffering the effects of trauma, and for first responders suffering from the emotional effects of their work with victims of trauma. Today, I'd like to talk to you about how a crisis such as the one we're now facing, COVID-19, reminds healthcare professionals that we need to seek out support and to preserve self-care while maintaining clear professional roles and engagement with patients. In the coming months, our healthcare system is likely to face an unprecedented demand for treatment of patients who have become seriously ill. The COVID-19 pandemic has reached across the world and will confront our medical, nursing, and support staff with professional, personal, and emotional demands, unlike anything most of us have seen in our careers. I'd like to take a few minutes to express my thoughts on how you can manage the emotions and the physical symptoms created by the stress that's caused by this unique situation so that you're able to maintain balance between your health and welfare and your professional role. These comments reflect my long interest in the effects of trauma on veterans, on victims of sexual assault and domestic violence, and natural disasters, including hurricanes and the 9/11 terrorist attack. Perhaps the best way to view the radical changes that physicians and other providers working in hospitals are experiencing is to view the COVID-19 crisis as a natural disaster of worldwide scope. In the current situation, our nation's hospitals are the focal point of society's expectations for rescue, for care, and survival, just as they were in past natural disasters, such as Hurricane Katrina. However, this situation is unique. It brings demands on our hospitals and their staff that are not comparable to anything in our lifetime. If we view the virus outbreak as a slow-moving natural disaster, we can apply the same concepts around resiliency that we would to supporting and caring for victims of trauma. This approach can help reduce the emotional traumatization of providers, what we call secondary traumatization, to help enhance their ability to care for patients who are the primary victims of this crisis. A poignant statement about vulnerability to secondary traumatization, often faced by healthcare providers, is from an Italian physician at the epicenter of that nation's outbreak. He said, "There is always a mixture of dread, of anxiety, of depression, and guilt if I bring this home with me." The idea of resilience has become a basic approach to protecting all types of responders in a natural disaster. Resilience is the capacity to recover mentally and emotionally from stressful events, and to return quickly to the functional state pre-crisis, to promote individual strengths needed to manage the stress, and to reduce the risk of post-traumatic stress. Rating scales have been developed to measure resilience, and these proved helpful in predicting recovery from trauma in survivors of the 9/11 terror attacks and hurricane survivors. The suggestions I'm offering are derived from efforts to assist healthy individuals in coping with natural disasters by enhancing their resilience. They're intended as prevention rather than treatment, but at the same time, they can enhance function and quality of life in these times of intense stress. The approach to building resilience combines cognitive, emotional, and biological actions, which can be applied as self-care, although online resources can also provide valuable advice and support. Cognitive approaches include remaining informed through factual sources, such as cdc.gov, and limiting the tendency to live in the 24-hour news cycle, because doing so may amplify fearful ideas. Instead of feeding into your fears, it's best to rely on a source of reliable, factual information so that you can, on a daily basis, take a realistic inventory of your fears and categorize them according to whether they're relevant to you, to your work, and your family in the present, or whether they're projections into the future. Then sharing your categories of fears with someone close to you, or keeping a journal of them for yourself, can help you focus on what needs to and can be done today. This process can help you to avoid catastrophizing and projecting these fears about the future into scenarios that become obsessive and exhausting. Biological approaches to building resilience include meeting your basic requirements for nutrition, hydration, and sleep, and limiting the use of stimulants like caffeine and alcohol. The nature of our work likely means that some of these needs may not be properly met every day, but we are expecting this crisis to extend for months, and we must maintain our health and function. We are all aware of the evidence that regular exercise contributes to emotional wellness, mental alertness, and physical health in both the short and long term. Social distancing may remove us from the gym, and work demands may squeeze our schedule. But remember that a 20 to 30-minute daily walk is shown to reduce our stress response. Self-regulation related to building resilience is a broad term that refers to deliberate practices that, when practiced on a regular basis, can become an integral component of stress reduction programs. These include yoga, meditation, Tai Chi, and many others. Their value in reducing the stress response, stabilizing the cardiovascular system, improving mood, and other benefits is clear. At Princeton House, our staff have advocated mindfulness practice based on focus on the breath while allowing the mind to clear. The usual recommendation is for 15-minute sessions, once or if possible twice daily. However, evidence shows that there are benefits associated with brief episodes of 3 to 5 minutes spread out during the day and as preparation for sleep. The method for this practice is described in the website for mindfulness-based stress response at the end of this presentation. Social connection is another core component in developing and maintaining resilience, especially for those who are affected by the disruption of daily life in a disaster. The social distancing in this pandemic limits access to outside contact, but those of us working in hospitals may have the opportunity to maintain contacts there. We may look for opportunities for space and scheduling, which will allow even brief interactions. Technology also provides opportunities for interaction. For example, social media sites intended to provide constructive sharing of experience, advice, and emotional support for healthcare workers who have a unique perspective and need in this pandemic have recently emerged. Creating meaning as we build resilience refers to the set of ideas about yourself, your family and community, your work, political and social commitments, and spiritual beliefs, which identify you and give you a sense of purpose to your daily life over a lifetime. For many people who work in healthcare, their career is a key contributor to their identity and purpose. For many of us, this involves a commitment to the practice and ideals of our profession and to the care of patients, as well as a commitment to the hospitals and related institutions that foster these values. The crisis now facing hospitals and their staff will challenge these commitments and create tension between conflicting values, such as between work and safety for ourselves and our families. As this crisis confronts us personally and our institutions generally with the greatest challenges in our lifetime, I am optimistic that our values and commitments will hold strong.